In this nursing mindset video, I want to talk about caring for patients with an ostomy. When nursing students first enter a patient's room, it's natural to focus on the ostomy itself. You may immediately start wondering, what type of ostomy is it? Is the pouch secure? Is the output normal? And those are important questions. But the nursing mindset asks a different question first. Who is my patient? And how can I help them today? An ostomy is only one small part of your assessment. The person living with that ostomy should always be your primary focus. Once you've introduced yourself and explained what you're going to do, begin your assessment by looking at the stoma. A healthy stoma should be pink to beefy red, moist and shiny. It is also normal for a new stoma to appear swollen during the first several weeks after surgery. You may notice a small amount of bleeding while cleaning the stoma. Because the tissue is highly vascular, slight bleeding with gentle cleansing is expected. However, some findings require immediate attention. A stoma that becomes dusky, purple, brown, black, or pale may indicate decreased blood flow and should be reported immediately. Likewise, excessive bleeding, a sudden change in size, or separation where the stoma meets the surrounding skin can all indicate complications requiring prompt evaluation. Remember, a healthy stoma should look healthy every time you assess it. Next, look at the skin surrounding the stoma. The peristomal skin should look like the rest of the patient's abdomen. If you notice redness, moisture, broken skin, rashes, pain, burning, or open areas, don't just document it and move on. Ask yourself why it's happening. Is the pouch leaking? Does the opening need to be resized? Is the adhesive causing irritation? Healthy skin is essential for maintaining a good pouch seal. Once skin begins to break down, leaks become more common, leading to even more irritation. Early recognition prevents bigger problems later on. Now turn your attention to the pouch itself. Don't simply look at how full it is. Assess the amount, the color, consistency, odor, and frequency of the output. Then think critically. Does this output make sense for this type of ostomy? An ileostomy normally produces liquid to semi-liquid stool. A colostomy often produces more formed stool depending on its location within the colon. A urostomy should continuously drain urine that is typically clear to pale yellow. One important nursing mindset pearl is hydration. Patients with ileostomies lose significantly more fluids and electrolytes than patients with colostomies. When you see an ileostomy, your brain should automatically think hydration, electrolytes, dehydration risk. That clinical connection helps you anticipate problems before they occur. Now let's talk about something that's just as important as your physical assessment, supporting the patient. An ostomy changes much more than bowel or urinary elimination. It can affect body image, confidence, relationships, work, clothing choices, social activities, and independence. Some patients adjust quickly, others struggle emotionally for weeks or months. That's why nurses don't just care for the ostomy, they care for the whole person. Make eye contact, introduce yourself, explain each step before performing it. Protect the patient's privacy. Encourage questions. Whenever possible, involve the patient in their own care. Even simple tasks like gathering supplies, emptying the pouch, or assisting with the pouch change can help build confidence and independence over time. Our goal isn't simply to perform care. Our goal is to help patients regain control of their lives. Good ostomy care also includes preventing complications. Check that the pouching system fits securely without leaking. Encourage good hand hygiene before and after care. Document your assessment thoroughly, including the appearance of the stoma, condition of the surrounding skin, characteristics of the output, and any patient teaching you provided. Encourage adequate fluids and nutrition as prescribed, especially for patients with ileostomies. When appropriate, encourage activity and a gradual return to normal routines. And remember, if something doesn't look right, ask for help. Experienced nurses ask questions every day. Patient safety is always more important than pretending to know the answer. The nursing mindset isn't memorizing the differences between an ileostomy and a colostomy. It's learning to think beyond the pouch. When you assess the stoma, protect the skin, recognize abnormal findings, monitor hydration, support your patient's emotional well-being, and encourage independence, you're doing much more than providing ostomy care. You're helping someone adapt to a major life change with dignity, compassion, and confidence. Because at the end of the day, the ostomy is only one part of your assessment. The person living with that ostomy is your patient. That's the nursing mindset. Keep developing yours.